Hi, my name is Dr. Torian Easterling. I serve as the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene. This is an introduction to COVID-19 vaccines. In today's presentation, we will cover important information on vaccines to help you better understand the COVID-19 vaccine, how it works, and what to expect in the coming months. This is a new pandemic and a new vaccine, and we know there are many New Yorkers who are still uncertain about getting vaccinated. The New York City Health Department is ensuring that equity is at the foundation of all aspects of its COVID-19 response, including regarding vaccine access. We must address the long-standing mistrust of the medical community and government due to historical and continued mistreatment of people of color, immigrants, LGBTQ+ individuals, and other groups, especially as New Yorkers face the decision of whether to get vaccinated. We are committed to gaining community trust, combating misinformation, and ensuring free and easy access to vaccine for all New Yorkers. Ensuring equitable access to COVID-19 vaccines will be accomplished by the following: opening vaccine sites in communities most affected by COVID-19, ensuring language appropriate and culturally sensitive communication and outreach materials and at vaccination sites, partnering with community-based organizations and community leaders, listening and responding to community concerns and input, providing up-to-date, accurate information about the vaccines, distribution, and access, including information about what we don't know. And also, and finally, monitoring data to identify gaps in access and enable a focused response. Here are some key messages about the vaccines and access that we want to make sure everyone understands. COVID-19 vaccines are safe and effective. COVID-19 vaccines are free for everyone. And COVID-19 vaccines are available to people of all immigration statuses. And vaccination is not a public benefit under the public charge rule. When people receive vaccine, their privacy will be protected. Importantly, we will not just say these statements, but will provide people with the facts and information they need to make informed decisions about vaccination, such as the information in this presentation about the COVID-19 vaccines, how they were developed and monitored, how they work, and what to expect when vaccinated. We want to start out by providing a brief summary of where we are in COVID-19 vaccine rollout and more generally in the COVID-19 public health emergency. This shows the current COVID-19 data for New York City. The map shows that COVID-19 is occurring throughout New York City, with the hardest hit neighborhoods in dark red. The figure shows the number of people with COVID infection each day, which, as you can see, is the highest since April. We are excited about the promises of vaccines, but we cannot throw the oars out of the boat just because we see shore. We need all New Yorkers to continue doing what we know works to flatten the curve again. Black and Latino persons account for a disproportionate number of COVID-19 cases, hospitalizations, and death. These disparities likely relate to structural racism, higher rates of pre-existing conditions, difficulties in practicing physical distancing, healthcare access issues, and other social determinants of health. Here are numbers on our COVID-19 vaccine tracker that you can also find on our website. Here is a reminder of what all New Yorkers need to be doing right now to prevent the spread and flatten the curve. Even after you get the vaccine, we must continue these key practices. Now, let's talk about what are vaccines. Vaccines help people develop immunity or protection from from a disease, so their body can defend against the disease if exposed. Vaccines do this by either preventing people from getting symptoms and complications from a disease or preventing people from getting a disease in the first place. There are many types of vaccines. While vaccines protect the individual being vaccinated, they can also protect the people around them and ultimately whole communities or populations. It must be clear, no vaccine works 100% of the time, and some people cannot be vaccinated because of a medical condition or because a vaccine has not been approved for some groups, such as children. This is why it is important for as many people as possible to get vaccinated. For vaccines against contagious diseases, as more people get vaccinated, it makes it harder for a disease to spread, helping to protect even people that are not immune or protected from that disease. When scientists develop an idea for a vaccine, they first test it in a lab. If the lab tests are successful, they enter clinical trials, which means testing the vaccine in volunteers. Let's talk about vaccine development and monitoring. There are four phases of vaccine clinical trials. Each studies whether the vaccine works and is safe. In phase one studies, a small number of people get the vaccine. In phase two studies, the study size increases and several hundred people get the vaccine. Phase three studies typically include thousands of people who either receive the vaccine or no vaccine at all, which is also called a placebo. Then the scientists compare the two groups. Ideally, the people in the studies have characteristics like age or health conditions similar to the people who will ultimately receive the vaccine if approved. After a vaccine is approved, scientists may continue to monitor its safety and how well the vaccine works during phase four studies. In this way, they will quickly become aware of any issues so that vaccinations can be halted if necessary. Vaccines must be reviewed by the U.S. Food and Drug Administration, or FDA, before they can be used. With vaccines, the FDA has a very high level of involvement. The FDA monitors vaccine development from beginning to end. The FDA also analyzes clinical trial data to decide whether to allow the vaccine to be used. And the FDA continues to monitor the vaccine safety data even after the vaccine is approved. In an emergency, the Food and Drug Administration may allow vaccines to be used before they are officially licensed by issuing an emergency use authorization, or EUA. This allows us to start using the vaccine right away. Importantly, this does not mean that shortcuts were taken. In fact, all vaccines issued an emergency use authorization must go through the same clinical trial as all other vaccines. And an EUA can be issued only if the evidence strongly suggests that the benefits outweigh any risk to the patient. In addition to the FDA, the Food and Drug Administration, several other federal agencies and external organizations monitor vaccine safety during trials and as part of ongoing evaluations after vaccines are approved. Here is a list of some of those organizations and federal agencies who have also reviewed the data for this vaccine. Development of COVID-19 vaccines have involved unprecedented resources. Billions of dollars has been spent and hundreds of scientists around the world have been working on vaccines nonstop. Let's spend a few moments talking about the COVID-19 vaccine. In developing COVID-19 vaccines, scientists built on many years of research from other vaccines, including research on vaccines for other coronaviruses. Also, the federal government provided special funding to allow development, testing, and production to happen at the same time. For example, Companies could start manufacturing vaccines even before they were done studying them. This is usually not done because if a vaccine is not approved, they would have wasted millions of dollars producing something they now need to throw away. Also, the federal government, state and local health departments, and healthcare providers have been working for months to plan for storage, distribution, supplies, and other logistics. Two vaccines have been authorized by the Food and Drug Administration for use. Both vaccines are being administered in New York City now. Both are mRNA vaccines. I will explain what that is in a moment. There are several other vaccines still being tested in clinical trials in various stages of testing. The two COVID-19 vaccines that are available are the Pfizer and Moderna vaccine. Both are messenger RNA or mRNA for short. COVID-19 messenger RNA vaccines contain genetic material from the COVID-19 virus. mRNA or messenger RNA are molecules that provide instructions. It is important to understand that while mRNA is a new type of vaccine technology, it has been studied for over 30 years. Here's how mRNA vaccines work. The mRNA enters the body with instructions on how to make a protein that is part of the virus that causes COVID-19. Then, if a person is later exposed to COVID-19, the body is now able to recognize the virus and produce antibodies to fight. Think of it like an email sent to your immune system. The email has instructions about what the virus looks like and how to kill it, and then the email gets deleted permanently. mRNA or messenger RNA does not affect or interact with the person's DNA. Two vaccines have been authorized again by the Food and Drug Administration, and we are using both of them in New York City. Both vaccines were shown to be safe and effective across all gender, age, race, and ethnicity groups. These vaccines are quite similar. I mentioned both are messenger RNA vaccines. They were both shown to be effective over 94% of the time in clinical trial participants, which is very exciting. This means that more than 9 of every 10 people vaccinated during the trials were protected from disease. Importantly, the vaccines worked well in people of different ages, gender, race, and ethnicity, and no serious safety concerns have been found. Tens of thousands of participants in clinical trials have safely received the Pfizer and Moderna vaccines. Over 20% were over the age of 65, and over 30% were Black and or Latino. Both vaccines required 2 doses, Pfizer separated by 21 days, and Moderna separated by 28 days. A key difference is that the Pfizer BioNTech vaccine were authorized for use in people 16 or older, but Moderna only for adults 18 and older. From clinical trials, we know the Pfizer vaccine to have 95% efficacy at preventing symptoms and decreasing severe COVID-19 infection. This means that more than 9 of every 10 people vaccinated during the trials were protected from disease. This is great news. The FDA requires vaccines to be at least 50% effective, and the Pfizer vaccine demonstrates much higher efficacy. Importantly, the vaccine worked well in people of different ages, gender, race, and ethnicity. And again, no serious safety concerns have been found with this vaccine. Similar to the Pfizer vaccine, the Moderna vaccine has demonstrated to have high efficacy of 94.1%. This means that more than 9 of every 10 people vaccinated during the trials were protected from disease. Like with Pfizer, the Moderna vaccine worked well in people of different ages, gender, race, and ethnicity. And again, no serious safety concerns were found. So then what is the difference between the two vaccines? They're actually pretty similar. As mentioned, both are mRNA vaccines. Also, they were both shown to have over 94% efficacy in clinical trials, which is very exciting. Both vaccines require two doses, and both vaccines can cause mild to moderate side effects, which I'll discuss a bit more later on. A key difference is that the Pfizer BioNTech vaccine was authorized for use in people 16 or older, but Moderna only for adults 18 and older. Other than that, the main difference has to do with how the vaccines can be stored and distributed. The Pfizer vaccine must be stored in much lower temperatures and must be used much more quickly once thawed, which may impact where it is available. As good as the clinical trial results are, there is still a lot we don't know since these are new vaccines. We are confident the FDA-approved vaccines are safe, but we are not certain about certain other things that take more time to study. This includes how long immunity from the vaccine will last, whether additional doses will be needed in the future, whether the vaccine is safe and effective for children. Note, Pfizer vaccine has been approved for 16 and older. Other considerations, whether being vaccinated prevents people from spreading the virus to other people, and what other vaccines may be available in the coming months. Now I'm going to talk about how the vaccine will get distributed. Since there is not enough vaccine available all at once, vaccine is being distributed in phases. The CDC's Advisory Committee on Immunization Practices, or ACIP, sets guidance for the country in New York City, and New York State's plan is based on these recommendations. This approach to phased distribution of a vaccine will be rooted in equity and will prioritize individuals who have been hardest hit by the pandemic. While we still have some details to work out, we know the basic groups of people that will be prioritized for the vaccine first. And generally, the people that are being prioritized fall in one of two categories. They are at increased risk of exposure to COVID-19, or they are at increased risk of having severe COVID-19 if they get it. People who work in high-risk healthcare settings, such as the intensive care unit or ICU, or in the emergency room, and residents and staff of long-term care facilities, such as nursing homes, were eligible to receive vaccines first, along with first responders and medical roles. Recently, additional populations have been made eligible for vaccination, including most healthcare workers, medical examiners, coroners, and at-risk funeral workers, as well as frontline public health workers with patient contact. We must expect essential workers who can't physically distance to get vaccinated, and people at high risk of complications from COVID-19 because of underlying medical conditions to be prioritized next, though the exact details are still being worked out. New York State determines prioritization for the vaccine based on federal guidance. The phased distribution will take time, and we do not expect vaccines to be widely available until mid-2021. People in the highest priority groups are already getting vaccinated, which is very exciting, but we have a long way to go. New York City will receive additional vaccines on a weekly basis. The exact numbers are decided by the federal government based on availability, the number of people needing to be vaccinated, and other factors. The health department oversees vaccine distribution to ensure healthcare providers throughout the city have access. Through a centralized database, we are able to see which healthcare facilities need more or less vaccine and place orders for vaccine based on need and storage capacity. Now I'm going to talk a bit about getting your COVID vaccine. First, why should you get vaccinated? Well, for starters, it protects you from the COVID no matter what age you are. COVID can have some serious consequences. Even if you have COVID-19, it is important to be vaccinated because it lowers your risk of getting it again. Second, getting vaccinated may protect those around you, particularly people who cannot get vaccinated and people who are at higher risk of complications from COVID-19. And third, vaccination, along with other prevention mentions, is how we can help end the COVID-19 public health emergency. First thing to note is that the vaccine will be available at no cost to everyone, whether or not you have health insurance. Also, it is available to everyone regardless of immigration status. It is important to understand that vaccines will not be available initially for children. This is because the vaccine is first tested in adults, and the information we have about safety is primarily based on trials in adult populations. Some groups, like pregnant and breastfeeding people and people with certain health conditions, were not included in the clinical trials or were included in small numbers. As such, there is limited data as to these groups. People may still be vaccinated, as based on the other available information, experts believe that the vaccine is likely safe and effective. Make sure to speak with your healthcare provider if you have questions about whether the vaccine is the right choice for you. It will be important that you have a plan to ensure you can receive the needed second dose of vaccine. The vaccine offers some protection after the first dose, but protects you much more after the second dose. The second dose should be the same vaccine as your first dose. For example, if the first dose was the Pfizer BioNTech vaccine, then the second dose should be the Pfizer BioNTech vaccine. The vaccine is effective 1 to 2 weeks after the second dose. The schedule for the second dose is slightly different depending on which vaccine you get. If you get the Pfizer vaccine, the second dose should be given 21 days later. If you get the Moderna vaccine, the second dose should be 28 days later. When you get the first dose, you will get a proof of vaccination document listing the vaccine you received and the dates you received it. Bring this card to your second appointment so that the second dose can be marked on the same card. Most people report some side effects from the vaccines, which are usually normal signs that your body is building protection. Common side effects are soreness or swelling on the arm where you got the shot, headache, body aches, and tiredness. You may also have a fever. Side effects are usually mild to moderate and can start within the first 3 days after getting the shot, last for about 1 to 2 days after they begin, and are more common after the second shot and less common in older adults. It is important for people to understand that these side effects are expected. You cannot get COVID-19 from the vaccine. You should call your healthcare provider if you have any side effects that bother you or do not go away after a few days, or if the redness or soreness where you got the shot increases after 24 hours. You can also talk to your healthcare provider about taking an over-the-counter medicine such as Tylenol or ibuprofen to relieve pain or discomfort. Get the second shot even if you have side effects after the first shot, unless your healthcare provider tells you not to. Based on what we currently know, serious allergic reactions are uncommon. Talk to your provider if you previously experienced an allergic reaction to a vaccine or an injectable medicine, or if you are allergic to any of the ingredients in the vaccine. You should receive this information when you go for your vaccine. People with a history of severe allergic reactions not related to vaccines or injectable medications, such as allergies to food, pet, venom, environmental, or latex, can get vaccinated. Allergic reactions are different than side effects. Allergic reactions generally start within a few minutes to an hour of getting the shot. Signs of a severe allergic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness, and weakness. If you think you are having a severe allergic reaction, call 911, go to the nearest hospital. After you're vaccinated, please stay vigilant. You must still practice the core four prevention measures after vaccination. Those are stay home if you're sick, maintain at least 6 feet of distance from others, wear a face covering when outside your home, and wash your hands often. This is because, as mentioned earlier, while the COVID-19 vaccines have shown to be effective, it does not work for everyone. So we need to continue to protect ourselves and the people around us, especially people who cannot get the vaccine, such as children. Also, we still need to learn more about how long the vaccine's protection lasts and the impact of the vaccine on disease transmission. We will let all New Yorkers know when it is safe to stop wearing masks and social distancing. There is a lot of misinformation about vaccines. Take the time to learn about the vaccines from trusted sources, such as your healthcare care provider, the Center for Disease Control, and the New York City Health Department. Vaccines are safe, and the COVID-19 vaccines has undergone the same level of robust analysis as other vaccines. Tens of thousands of participants in clinical trials have safely received the Pfizer and Moderna vaccines, and at least 30% of all clinical trial participants are people of color. As more vaccines are rolled out around the world, we will have more data and information every day. When it's your turn to get vaccinated, it will be easy, safe, and free from barriers such as cost and immigration status. Here are some of the resources listed on this slide that you can take advantage of. This concludes the presentation. Thank you very much. For more information, please go to nyc.gov/COVID vaccine. For mental health support, please chat online or visit us at nyc.gov/nycwell or text WELL to 65173, or you can call 188 NYC Well. Thank you.